name is William LaFleur.
And I'm Kyle Dayton, and for our topic, we reviewed an article that looked at the efficacy of Paraffin Bath Therapy for the treatment of hand osteoarthritis.
According to the authors, this study was the first of its kind to examine the efficacy of Paraffin Bath Therapy in reducing pain, improving function, and increasing muscle strength.
This study took place over the course of 30 months. Participants were recruited from an outpatient rehab clinic in Izmir, Turkey, and randomized into two groups using two independent researchers. The authors used a medium effect size to determine that 64 patients in each group would be an appropriate sample size. Initially, 56 patients or participants met the inclusion criteria, but 10 were lost in the follow-up process. This left 24 in the intervention group and 22 in the control group. This study protocol was approved by the ethics committee of this hospital.
This study demonstrates level 1 evidence based on the use of a prospective single-blinded randomized controlled trial. The randomization was carried out by an independent researcher using block randomization to assign patients into their respective groups. The researchers also incorporated strict inclusion and exclusion criteria in order to ensure that the participants met the specifications of the population that they were targeting.
The intervention group received paraffin bath therapy for 5 days a week for a total of 3 weeks. Paraffin wax was applied using a dip wrap technique where each hand was dipped, removed, and allowed to harden. And then they were re-dipped for a total of 10 times. Once the last layer was able to harden, the hands were wrapped with a plastic bag and covered with a towel for a total of 15 minutes. The control group was asked to keep a drug diary of the paracetamol or acetaminophen intake throughout the duration of the study.
This study found that paraffin bath therapy had no statistically significant effect on hand function, but seemed to reduce pain while increasing range of motion in the experimental group when compared to the control group. These results remain consistent at 3 and 12-week follow-ups. The experimental group also showed a significant decrease in pain and tenderness in the affected joints, with improvements in grip, chuck pinch, and left lateral grip strength at 12 weeks.
One of the greatest strengths of this study is that the design is a single-blinded randomized control trial, which having randomization in any study is always going to be a positive. And it's also beneficial that the researchers who recorded the measures were blinded to group allocations because it will mitigate any chances that there's intervention bias. Another benefit of the study is that all participants were adherent to the paraffin bath therapy as well as the journal keeping for their drug intake, which all contribute to the strength of the study.
Some of the limitations associated with this study include the inadequate sample size. So the authors did a power analysis that determined that 64 patients in each group would have been an adequate sample size, and the study only ended up with 24 in the experimental group and 22 in the control group. Other limitations included that the strength of the study, it wasn't powerful enough to distinguish functional dimension alterations regarding the off-scan and the DFI. They could have also included a placebo or a sham control group. And one other limitation was the fact that there were more females than males in both groups, and having an equal number would have made the results more applicable to the general population. Also, there was a lack of previous research and data on the topic, which means that the authors were required to develop their own study design and methodology.
This study labels paraffin bath therapy as an evidence-based modality that can be used as an adjunct in the treatment of hand osteoarthritis. It also serves as a benchmark for further research on the topic. Future research should assess a larger sample size for a longer duration and consider different methods of paraffin delivery.
Studies like this one are important to a profession like occupational therapy because it strives to center itself around evidence-based research.
And this particular study will give us something to reference if we're ever dealing with patients who have bilateral hand osteoarthritis. And even though the results seem to be short-term, this can be hugely beneficial because if we could decrease pain and improve range of motion in our patients, not only will it be able to get them working on functional tasks sooner, but it could also build the patient-therapist relationship and improve the long-term efficacy of your treatment.